Our next presentation is by Heidi Rosvold-Brenholtz. She is the Senior Vice President for Strategic Engagement, Policy, and Science for Healthy Women. Her primary task is to educate Healthy Women's audiences about policy issues and decisions that impact their health and their communities. And she's a founding partner of Healthy Women.
Hello, everyone. So my role here today is slightly different than my fellow esteemed panelists. I will not be engaging much in statistics or epidemiology, although these numbers thrill and frighten me both. My job is to talk about women's health and this 25-year progression of promise and progress. Our time machine target is 25 years, but I'd like to turn the dial, or I should maybe say adjust the digital button, back just a little bit further to include a 30-year time frame. It's both amazing and astounding to me to consider the accomplishments across policy, research, clinical care, and advocacy for women's health during the past 3 decades. A time in which Healthy Women, formerly the National Women's Health Resource Center, was born and grew up with what I like to call our sister organizations, the Federal Offices of Women's Health at the HHS, the FDA, the NIH, and soon after, in 1994, the CDC, and a number of other consumer, patient-focused nonprofit organizations, all with the goal to advocate, research, and invest in the unique needs of women's health, among other needs where a population is concerned. It's amazing because of the positive impact this progress has had in advancing women's health, and by extension, the health of our families and of our communities. It's also astounding because it seems like such recent history, right? For many people here in the room, some of these milestones occurred before you were born, but it's still a very small window in time. There's so much more to be done and so many more promises to keep. In 1988, the National Women's Health Resource Center was created at Columbia Hospital for Women by an obstetrician gynecologist named Dr. Violet Bowen-Hugh. She was a women's health champion, and she recognized that women needed resources to help them overcome knowledge barriers where their health was concerned. Our organization was founded on 2 very simple concepts: independence and advocacy. Women wanted and needed health information to understand and manage their health, information that they weren't getting or couldn't get from their healthcare providers. Number 2, women would use resources, Dr. Violet Bowen-Hugh knew, if they were easily accessible, easy to understand, and spoke to women directly to advocate for their healthcare needs. We also recognized that women wanted health resources on topics beyond their reproductive health needs. At Healthy Women, or the National Women's Health Resource Center at that time, this meant providing women with accurate, objective, and comprehensive resources, developing, individualizing, and delivering this information. We provided personal support. We actually picked up the phone, or we responded by mail to women's most personal and complex questions in these pre-internet days. Questions ranged from things like, how does my menstrual cycle work? I'm afraid that there's something wrong with mine or with me. Where can I learn more about silicone breast implants and the dangers to my body they could pose? How to recognize a heart attack symptom or a stroke symptom and how to tell the difference? How to treat or where to get a diagnosis and treatment for specific sexually transmitted diseases. Early in our history, we recognized that we could improve the dialogue healthcare providers were having with women, or most likely not having. We reached out to a broad range of providers and created consumer health-focused, we purged the word patient in a lot of situations, consumer health-focused information for healthcare providers to distribute in their offices or use as primers themselves for their conversations with their patients. Healthy Women continues to meet women's needs today by tailoring health information and creating a personal experience for our more than 1 million visitors a month on average to our website. The first women's health resource on the internet. Women healthcare providers, the media, and our many partners from sister organizations, federal agencies, industry, and even the Men's Health Network know Healthy Women is a trusted source for women's health information and a committed partner to advancing women's understanding of their health and thus improving their health care. I'm going to go quickly through a couple of milestones thanks to a timeline created by HHS. Just to give you an idea, this snapshot in time of things that happened in the last 25 to 30 years. Between 1988 and 1989, the DEXA scan was approved for clinical use to diagnose osteoporosis. Manufacturers were required to submit safety and effectiveness data on breast implant products or withdraw them from the market. Between 1990 and 1995, the National Breast and Cervical Cancer Early Detection Program was established, and the Violence Against Women Act in 1994 put domestic violence on the map as a major public health issue. Women needed to understand what these advances in research, in science, and advocacy meant to their health. And that's where Healthy Women came in, to develop information to help women explore with their healthcare providers, explore with their families, what they should be doing to keep themselves healthy or to address specific disease and condition information. Between 1996 and 2001, the first of 6 National Centers of Excellence in Women's Health was established by the Office of Women's Health at HHS, providing nonprofit organizations with new partners and resources, again, to share with women and their families about their health. The breast cancer prevention trial and the study of tamoxifen and raloxifene, the STAR study, was a major advancement. It demonstrated that half of breast cancers can be prevented with a medical intervention. It provided a new paradigm and provided a preventive option for women where none existed before. Between 2002 and 2007 was the oral contraceptive and breast cancer study, which showed no increased risk of breast cancer with oral contraceptive or HRT use, hormone replacement therapy. There was also the Heart Truth campaign that began to open our eyes to the differences in women where heart disease symptoms were concerned. So where are we now? The progress. The consumer health information revolution, which I've outlined a bit of today. Women are getting more information, they want more information, and I think we're improving their health with more information and the health of their families. Women are the CEOs of their families, healthcare needs, and communities benefit from women as informed healthcare consumers. Fact of life, women's health is broader than their reproductive health, with focus on aging well across the lifespan. Another hugely important piece of progress, the Affordable Care Act and access to preventive health services at no cost. It improved health care for women and importantly for women of color, with increased rates of health screenings, including mammography, cervical cancer screenings, and access to primary care providers. Another example of progress is identifying the impact of chronic disease and of particularly the effects of chronic disease on communities of color. Number 5, Viagra. Because this is a briefing with the Men's Health Network. Viagra helped put sexual health on the map. And for women, there's a long way to go, but it helped evolve the focus on the importance of sexual health dysfunction in women's health. Promises, I'll go through them quickly. I have 5 for the future. Affordable health care and access to care needs improvement. It needs to be front and center of everyone's mind. Shorter time to treatment and accurate diagnosis for conditions such as fibroids, endometriosis, depression, and heart disease. Women are waiting too long to be treated and effectively diagnosed with interventions if they exist. Improved maternal health, it's a major crisis in America. We're the only industrialized nation with a rising maternal mortality rate. There are a lot of known reasons, and there are a lot of unknown reasons for this statistic. Viagra, again, improved treatments for sexual dysfunction in women is a big need, and we need more investments in women's health where sexual health is concerned, and improving safe and effective pain management, to the points about trying to understand and get control of the opioid use disorder epidemic in this country and its unique effects on women and their communities. Thanks very much.